to Glen Shield, the home of St John in South Africa. Please come in. It may interest you to note that during the Second World War, this was an auxiliary hospital for soldiers returning after the war. Shortly after that, this became the home of St John permanently, and in 1950 we were declared a priory, a self-sustaining organisation within St John. Plaques on the wall tell our story. Probably noteworthy at this point is the Queen's Diamond Jubilee year of 2012, when we had a visit from Her Royal Highness, the Princess Royal. You'll also see on the wall is a plaque commemorating the fact that this is now a historical building of historical significance. But come inside, let me show you a little more. This plaque here reminds us of the work of St John during the Second World War, but it also guides us in the principles that we apply now. And this plaque commemorates the fact that this was an auxiliary hospital from 1943 to 1946. And the great houses in this area were all requisitioned for that purpose. Come inside and I'll show you some other items of interest. So here we have the 900th commemorative stamp. That was commemorating the 900th anniversary of the founding of the Order of St John. And Nelson Mandela, who was a Knight of the Order, and also what we refer to as a Bailiff Grand Cross, they used ham to commemorate this stamp collection. So very beautiful, and it was an international stamp collection and a great source of pride for us. And of course, in this you see Glen Shield in all its splendour as well. We'll come through. Here you see a portrait of Archbishop Desmond Tutu, who was one of our former priors of the Order of St John in South Africa. A remarkable and wonderful, wonderful man. And as you know, a great stalwart in South Africa, someone who speaks truth to power. And we were very, very privileged to have him as our prior. Come through. So perhaps out of interest, as we go into my office, I'd show you our trophy collection. There are many trophies in this building of St John Brigade and the many accomplishments. But amongst them is the Empire Trophy from 1887, which is a source of great pride. And we still have a flourishing and strong brigade unit here in South Africa, primarily dedicated to the development of youth in this country, and also giving them vocational skills. But we can chat a little bit more about that later. But why don't we go through to my office and have a cup of tea together as we discuss more about the Order and its work in South Africa. So why don't we have some tea? I can tell you a little more about our work here in South Africa. So as I briefly mentioned at the opening, we've been active in South Africa since the late 1800s, roughly 137 years. And our work has always been caring for the needs of the sick and the poor. And I suppose what's important to note is in South Africa's changing demographics, our work has increasingly been amongst the more socially disadvantaged communities. And so we do a number of things now. There is the traditional work of St John Ambulance. We have a beautiful fleet of ambulances doing duties every single day. We also have a paediatric step-down facility for children with life-limiting diseases. We're about to rebuild that facility in partnership with the government of Luxembourg and the Roy McAlpine Trust. And so beautiful work that we do there as well. And again, it's palliative care, it's hospice care, and remarkable staff who work in that space. And of course, we also care for the elderly. We have a retirement village, and in time to come, we will be partnering with the Johanniter Orden, which is the German order here in South Africa, and we will be potentially running their retirement villages as well. So fascinating, wonderful organisation. Again, such a privilege to be part of it. Now we have now moved primarily into emergency provision or provision of emergency services. Our eye care clinics around the country screen for glaucoma, screen for deteriorating eye conditions, primarily geared to preventing blindness. It's extraordinary. 80% of blindness globally is in fact curable if carefully managed. And so our eye clinics do remarkable work. And in South Africa, we've become one of the largest optometrists. We also have an eye hospital that we started in 1951. It was eventually handed over to the Department of Health in 1963. We're about to rebuild that eye hospital, and we have beautiful plans, and it would be lovely to be able to show you those plans as well and show you our dreams and aspirations. Our eye hospital is a tertiary hospital, and it is linked with the University of the Witwatersrand. So extraordinary work. We have community healthcare workers in the field every single day. And why this is important now, as COVID has taken the world by storm, our community healthcare workers are in the field every single day, screening and assisting. We do pediatric care, we do palliative care, we do home-based care. Our community healthcare workers are in fact the jewel in our crown. Our training department does exceptional work. We do what the rest of St John does the world over in levels 1, 2, and 3 first aid, but we also do auxiliary nursing, and again community healthcare workers level 2 and level 4. All of our qualifications are accredited by the Health and Welfare, SETA in this country, the Department of Labour, and in more recent times we've begun partnering with universities in our accreditation as well. Something that's quite topical now is mental health and mental health awareness. And so St John, South Africa is also stepping up its work in mental health awareness and indeed mental health first aid. We also have a medical supplies business, so we supply first aid kits, we supply PPEs, which have become quite topical of recently. We do sanitizers, we do all sorts of things that ultimately help our revenue models. And I think what's quite important is that we've moved from a purely charitable organization to now being a not-for-profit company, but all of our surplus is again redirected to charitable outcomes. It's a wonderful organization. It's an absolute privilege to be able to serve this organization and to be part of the global body. We punch above our weight. We work with priorities that are far larger than we are. But our clinicians are working with the Clinicians Work Group. We're leading the digital transformation of St John globally. So we're having loads of fun. But perhaps to note, these are difficult times. And so we've had to navigate the advent of COVID and its impact on our organization. But I'm privileged to work with an exceptional team. That is St John. It's been really tremendous being able to introduce you to the work of St John in South Africa. Thank you for visiting us.